That said, the issue is still very perplexing and daunting for child care providers and for parents. And News 3's Linda Eggert joins us now with that story. Linda.
That's right. Consider the potential for chaos. Just one daycare center closing could throw more than 100 working families into emergency mode. Centers are working on policies right now, doing the best they can to handle a difficult situation that's still unfolding.
Everyone's wondering, how bad is this going to be?
Like spring, daycare centers are wondering, will H1N1 come in like a lion and go out like a lamb or not? Local public health experts now say the predicted big fall outbreak has started, but appears to be mild, lasting only a few days. But child care providers have to be prepared for anything as they wade through sometimes overwhelming and confusing government policies.
I think there's a lot of confusion just in general. I think parents are confused. Their information, is not all that clear, and then our information isn't all that clear, what we're supposed to be doing as child care centers.
At Once Upon a Time Child Care Center in Verona, confusion over a federal policy that at first recommended closing schools last spring led to this recent newsletter to some 100 parents. If we have a confirmed case of swine flu, the state will close us down immediately for at least 2 weeks. But that's not true, as center owner Ann Schmidt has just found out, and now she has to tell parents that's incorrect, and that the center, if at all possible, will remain open despite any H1N1 outbreak.
At this point, our policy is to stay open.
That's good news to the public health director of Dane County, who urges all centers and home care providers to do the same.
So we'd like the child care centers to stay open, but just know how to deal with sick children.
And that means noticing the symptoms of flu, like fever, cough, and fatigue, and promptly getting a parent to pick up that sick child and take them home. Schlenker says it's no longer necessary to keep kids home for a week. They can return 24 hours after they are symptom-free. An H1N1 pandemic planning program for daycare providers will be held Friday afternoon at Meriter Hospital, and that'll probably be a big draw. It's a pretty difficult situation to get your arms around.
And as you mentioned, affects a huge part of the working public as well.
Yes,
lots of folks.
Key piece of society there.
All right.